Hi, Mr. Smith. It's so good to see you here today. My name's Abigail, and I'll be your hygienist. Hi, thanks. Glad to be here. So, I see that you marked on your health history form that you were interested in quitting chewing. Could you talk to me a little bit more about your habits and history of tobacco use, how often you chew, and if you have tried quitting before? Sure. I've used tobacco for about 5 years now. I chew 4 times daily when I'm on my way to work in the morning, at lunchtime, when I drive home from work, and then yet again whenever I've had dinner. I've also tried to quit once, but that only lasted for a couple of days. Thank you for sharing, Mr. Smith. Do you mind if we discuss some risk associated with tobacco use? Nope, that's fine. Okay, chewing can not only affect your oral cavity, but it can also affect other areas of your body. Chewing has often been shown to lead to oral cancers such as cancer of the mouth, the tongue, the esophagus, the cheeks, even your stomach. The ultimate price to pay for that would be death, obviously, and that also puts you at a high risk for heart disease, heart attacks, stroke, things like that. There's just some major health problems that are associated with tobacco use specifically. Chewing can also cause gum tissue loss, which your gums are what sit above your teeth. This causes you to be at a higher risk of exposure for recession, tooth mobility, tooth loss, exposed tooth roots, and just a lot of other clinical things that would be an appearance issue about your mouth. Tobacco has also been linked to causing decay in your mouth, as well as a lot of sensitivity of your teeth, and also just overall just having sores that are painful that just sit in the mouth. And over time, tobacco use often causes staining among your teeth. Wow, that is a long list of things that could potentially go wrong. If you don't mind, you can look over here at my chart that I have that's going to show you your probe scores. So healthy tissue is probed at 1 to 3 millimeters. And what that means is when we stick the probe into the base of the pocket, which is the gums that surround your teeth, we're checking for bone height levels and to see if there are any deep pockets that would cause areas of concern. These deep pockets can lead to loose teeth, recession of your gums, where your gums just recede away from your actual teeth and the roots of your teeth are then exposed, and which I said leads to tooth loss, and recession could be present in a lot of areas, from maybe too hard of brushing, but tobacco use also does lead to this, as well as recession should not be in a healthy mouth. What we're looking for, like I said, is 1 to 3 millimeters, and a lot of times we will find more than that. And then also with recession, you add those together to get a higher number. So with your case, your chart shows some 4 millimeter pockets in some areas and 2 millimeters of recession. So if you have a pocket of 4 and then 2 of recession, then that would be 4 plus 2 is 6, and that would be a 6 for your clinical attachment loss, which is kind of a lot compared to 3, 2, or 1 for a healthy base sulcus. And that is primarily just in your back teeth there. Thank you for showing me this. I've never really been informed on how tobacco use could really affect my life. No problem. How about we make a plan for you to quit tobacco now? Sounds great. I'm willing to try it. Okay, let's start by implementing small increments of exercise on those times of day when you would normally chew. If you have a craving, instead of giving into the craving like you normally might, let's try a sugar-free gum to chew on during that time of day. And another thing that you can do is to drink plenty of water throughout the day, just to keep your mind busy and keep your thought process on constantly drinking that water. And when a craving does hit, make it a point to stop what you're currently doing and distract yourself with something else to do. Maybe another task to keep your mind busy. Just constantly try to keep yourself in check and in focus, and stay motivated, because in the long run, it is better for your health, as your oral health, and also your overall health of your body, and you're just going to be saving yourself in the long run. So if you have any questions, I'm here, and I would like for you to stay motivated. Just know that you can quit and that I'm always here to help. Thanks. I really like that plan and I think that I can do it. Thank you for your help. I really appreciate it. I'm going to try my best to quit and I look forward to finally being able to quit.